Okay, so we're going to run over a pigmentation treatment now on the face. So because we're working on the face, we've already done a patch test 24 hours ago on the underside of the forearm. So we're going to use those same settings we got to on the patch test. So same again, skin type 2, intense treatment, standard IPL. We finished on 33, so just going back to your client record card and using those same settings. So 33, we're starting off there. The filter is a 510, so we'll put the 510 filter into the handpiece. So just checking those two things before we proceed. We've done a cleanse with what we've used here is a Nimue gentle cleanser, just to cleanse the surface of the skin, making sure there's no moisturisers or anything on the skin. Also just covering the hairline, and because we're working on the face, we put some half round cotton pads under on the client goggles. So just coming into standby. Okay, so now that we've got the treatment area all ready, we're coming into ready mode. So just making sure that when you're doing the treatment, we're not going any higher than the eye orbit. So just feeling that that bone there, we're not coming any higher than that. And then also when we come around the side here, we're not shooting up the nose, making sure that we're not shooting up directly up the nose at all, and then just covering the hairline with a wax strip as we kind of go around the hairline, working around that area. And so this is what we call the stamping technique, working our way around the area. And so just a light press on that goggle as well, just feeling the eye orbit, the bone there, and one flash there. Just slowly work your way around the face. And so what we're looking for with this treatment is for the sunspots and age spots to darken, and then what they'll do over time is they'll flake up, and you can either do a microdermabrasion treatment or just let them naturally exfoliate and fall off. So wax strip on the hairline, and just working our way around the top. So we've got a little bit of the crystal showing here, so we'll just put the wax strip there, just to cover that surrounding skin, nice and flat here. So now we're going to be working right across the top of the eyebrows here, so also covering those. Alright, so we've just got the upper lip and the nose to go. So depending on the crystal size, it can be a little tricky to get onto the nose here. So showing on here, we're just going to press it in, and we're going to grab our wax strip and just cover that exposed crystal. Same on the other side. So just asking your client to bring their tongue between their upper lip and their teeth, or you can put a cotton swab in there. So just covering the lip area, and we're just coming across here. Alright, so that's one pass over the area. So what we'll do is we'll hang the handpiece up, come off ready, and we'll just take a quick look at the skin. So sometimes you'll, after that first pass, you'll get to the desired result, and you'll see the pigmentation darken quite a bit. Right, so what you're obviously looking for is darkening to the pigmentation. So if you haven't gotten the desired result after that first pass, what we'll do is we'll increase the energy by 2 levels, and we'll do a follow-up pass, and we can do that up to 3 times, especially on the first treatment. We go through the process slowly and coming up in increments of 2, rather than increasing it right up and kind of going for it. So it's just a safety precaution that we take with all of our machines, and it's recommended for that first initial treatment. So when they come through for their follow-up treatments, you've generally got it bang on for the right treatment settings that you'll need for follow-up treatments. Right, so just increasing the energy level by 2, 1, 2. So the top recommended setting is 33, and we're at 35 now. So keeping in mind that the recommended settings are quite conservative, and we have to keep them that way and leave it up to the operator to make the judgment and the call on that. So we've come up 2 levels from the top recommended setting, back onto ready. We'll do another pass here. So just starting wherever you want, you can start either side and just making sure that you're covering the whole face. Just a light pressure on that goggle there. Making sure you're not coming any higher than that the eye orbit bone. Alright, just on the hairline with the wax strip. Same with across the top of the eyebrow there. So if you were to go over the eyebrow in a pigmentation treatment, it won't necessarily kill the hair follicle, but it does have the chance of making the hair fall out. Yep. Alright, so just covering the lip again, just coming across here. And so generally we get the handpiece to stop in the middle of the upper lip there. So quite often clients will feel a bit of sensation in the upper lip, just reassuring them that it's not damaging their teeth or anything. There's quite a few nerve endings in the top of the upper lip there, and they'll be feeling it in their teeth as well. But generally that tongue in between the top upper lip or a cotton swab is best help with that. So once again, that's another pass. So sometimes you'll go through for that second pass, and the desired result will be there for that pigmentation. But keep it in mind, once again, for a initial pigmentation treatment, we start off quite low and bring it up slowly. So I would want a bit more darkening to that, so we'll do one more pass, increase the energy level by 2, one more pass over that treatment area there. Alright, so just keep it in mind that sometimes you'll do that second pass and the pigmentation will darken a little bit, or you'll see a little bit of inflammation on the skin, and we wouldn't recommend to do a third pass after that. We'd leave it at 2. We'd we'd write down the settings on the record card that we finish on, and then we'd use that for the next treatment, follow-up treatment for that client. So we've just done that second pass there. We're on level 35, so we'll just come up 2, 1, 2. So now we're at 37, which is 4 above the top recommended setting, and this is generally where you'll be with most skin rejuve, pigmentation, vascular and acne treatments. So just back on to ready, and just making your way around the face area again. So it's always quite important. Number one safety precaution is the eyes, so just making sure that they're always covered. And upper lip. Alright, so that would be the full treatment done. Just keeping in mind that sometimes you won't get to that third pass around the treatment area, depending on skin. This client here is quite, I would say, robust skin, so it doesn't inflame, it's not so sensitive, but sometimes you'll even do your first pass and you'll see a slight bit of inflammation to the epidermis, and you would stop at that first or second pass, for example. But most of the time you will be able to get through to your third pass. So what we've done there is we've finished on level 37 for the energy. So what we'll do is we'll write that down on the treatment record card. When the client comes back in for their follow-up treatment in a month's time, we'd start off on 37, do our first pass on any pigmentation that's left there, and just we have to leave it up to the operator to make the judgment if they need to do further treatments after that or another pass. So just coming off standby and off ready, so that would be the treatment complete there. So now we just remove all the gel from the treatment area. Just take a look at that pigmentation. As you can see here, it's darkened quite a bit, which is what we're looking for. And just keeping in mind that the client's aware that it will darken over the next couple of hours as well. Making sure that they don't pick or scratch at any flaky pigmentation that flakes up. If you do have a microdermabrasion machine, what we recommend is the client coming back in 2 weeks' time for a microderm, and then if they need a follow-up pigmentation treatment after that, it'll be a 2-week period from their microdermabrasion treatment. So 4 weeks in between treatments for pigmentation, and sometimes you can get rid of the majority of it in the first treatment. So what we do after removing all the gel is we'll put a Nimu soothing cream on the area, and that just helps with any inflammation on the skin after that treatment. Keeping in mind that the pigmentation, skin rejuves, vascular and acne treatments are quite it can be uncomfortable. They're minimally invasive, but they do inflame the skin a little bit compared to our SHR treatments. So just keeping that in mind for when you're treating those clients for those treatments.